this is just a picture of our large local reaction. As you can see, there's quite a bit of redness or swelling at the site at the arm. And I think a lot of patients don't really think about, in terms of venom allergy, that it is an allergy and when should I even be evaluated. So the most important thing is the history, because up to 27% of people in the population, if you just randomly skin tested them, they'll have a positive venom test. So it's really important to know what their history is. So the indication for venom testing is if you've had a systemic reaction or you've had a really severe type of local reaction. And there are two types of testing available. You can do a skin test. You can also do a serum IgE test. And with skin testing, it's positive in about 70 to 90% of patients with a convincing history of a systemic reaction. Now, 20% of positive skin test patients may have negative serum IgE testing, and 10% of positive serum IgE testing may have a negative skin test. So if someone has a really convincing history, and for example, your skin tests are negative, then looking at the serum is another way to evaluate that, just to make sure, especially if the history is very good. Now, keep in mind, after a sting reaction, skin tests can remain negative for 4 to 6 weeks after a sting. So if someone is evaluated during that time frame, and if it's negative, it doesn't completely rule out the possibility of venom allergy. So it's almost like there's this refractory allergic period where that testing can be negative in that time. So it's important to consider reevaluation again down the road, for example, 6 to 12 weeks later.